today is an important day. 1st of September is the launch of Blood Cancer Awareness Month, and as part of the month's activities, Leukaemia Care are launching our Spot Leukemia campaign, which basically is a two-armed approach at raising awareness of the symptoms and challenges of people who may have a leukemia, to encourage the public to potentially gain some insight or knowledge of the vague symptoms that might mean they should see a doctor, whilst at the same time accompanying that with an educational tool we've created, an e-learning module that's on the Royal College of General Practitioners website, to empower GPs to be able to also be able to identify these groups of vague symptoms that may enable them to identify early specific types of leukemia and offer, as well as recognition and diagnosis, appropriate referral. The module is available now. It's on the RCGP e-learning section of the website under blood cancers. If a GP is not registered with RCGP, just register and take the course. Again, it was accredited for CDP points. The module, it's in two modules. The first module looks at the background and the details about the disease. The second is more on case studies and holistic application and actually working in practice and how to identify or recognise or maybe trigger that recognition and then appropriate referral. It's a busy month this month, but following on for this in January, towards the end of January, we're working with the Midland Royal College of General Practitioners and their educational team, and we're piloting an in-person meeting which will follow on from this course to have some practical, real-time case studies, role play, and also talks from patients and clinical experts, consultant experts, to look at current signals, current testing, current practices, and also the application of that, the holistic use of that, listening to GPs who maybe have a special interest and a greater depth of knowledge at this moment in leukemia, how they can actually pass that knowledge on to their colleagues. It's all about empowering GPs to have a greater depth of understanding, maybe recognise those one or two very rare cases that they might miss. Because what we have to face is that, leukemia is still a rare disorder, and a GP may only see one or two over a period of a couple of years in their practice. And we know that early diagnosis saves lives. The problem we have with the leukemias is the percentage that present is extraordinarily high, present as an emergency is extraordinarily high, between 38 and 65%, versus the national cancer average, where 22%. So this is our attempt to a two-handed approach, which is reduce the patient delay with our toolkit that's there to empower patients to maybe recognise those symptoms, at the same time as working with the GPs to reduce the clinical delay. With the hopeful outcome, more people will be found soon enough and get appropriate diagnosis and treatment.